You may well have a preconception around what an ambulance service does, hence the photographs that you've just witnessed. But ambulance trusts are much more than what you've just seen. They're much more than self-employed individuals, as they might like to think they are, running around in yellow vans with flashing lights. And when it comes to infection control, you'll see we aren't that much different to other healthcare providers. We have the same challenges, and like yourselves, we need to meet those challenges head on. So I'm going to talk a little bit about West Midlands Ambulance Service and the challenges that we've faced and how we've done our best to overcome them to ensure that our patients do receive the very best in regards to healthcare. But a lot of what I say is generic, in as much as all ambulance trusts are striving very hard to achieve safe patient care. So a little bit about us. West Midlands Ambulance Service as an organisation has now been recognised as consistently the highest performing regional trust in the country and was named Ambulance Service of the Year for 2007, 8 and 9 by the Ambulance Service Institute. It's a regional trust, covers a geographical area of approximately 5,000 square miles and serves a population of 5.3 million people. And they're spread around Shropshire, Herefordshire, Worcestershire, Coventry and Warwickshire, Staffordshire, Birmingham and the Black Country conurbation. The Trust has a total number of 3,300 members of staff, 58 ambulance stations and uses 864 vehicles. So challenges. The first challenge, and what I want to do now is take you back 2 years, because this is where the journey really started, was to find suitable products for the environment in which we work in. And it was rather like walking into a supermarket and walking down the aisles, and every aisle would say acute, acute, acute. And then we'd get to that little deli counter in the corner that we all love so much. Well, I do, because they do pork pies and stuff. But there was the ambulance service section. But when you looked at that section, it was all the same stuff that we just saw down the acute aisles. There didn't really seem to be any products that were particularly suitable for the ambulance trust. So we set our stall out 2 years ago of trying to find such a product. And if we couldn't, we were more than happy to help develop products that would be suitable in the environment that we worked in. And we identified two. We use a two-stage cleaning regime. The first is to remove any organic matter, because we all know that disinfectants become inert if they're exposed to organic matter. The second was to develop a disinfectant that was very, very safe for us to use. And we did that in collaboration with the commercial sector. And after developing the disinfectant, as it is now, we had a research laboratory come out and take samples inside the ambulance, about 28 different areas using agar and soy plates. And that was before the vehicle was cleaned and after the vehicle was cleaned. So we could look at the log reductions. We did this several times. And that was really to make sure that we were really happy with the efficacy of the products that we wanted to use. And I think it's fair to say at this stage, ambulance services aren't just about vans. They're not just about ambulances. Ambulances mainly consist of hard surfaces, but we have huge office complexes. We have our control centres. And if everybody in a control centre was to go down with norovirus, there wouldn't be anybody to send out an ambulance in the first place. So you could look at that as our Achilles heel or our underbelly. Very important to us that they are also kept secure. We were able to publish the work that we did and got the necessary certification around the product being a useful disinfectant. And it was tested against 1,000 parts per million chlorinated bleach. That was a lot of hard work, but just when we thought we were getting somewhere, this happened. And it is, they're here. That's the phone call that we had. Oh, you've had the similar one, I can tell. Yes, they were out and about. The Care Quality Commission. They visited our headquarters, very briefly, just to say that they were there and that they were going. They visited our ambulance stations, they looked at our vehicles, and they spoke to our staff. And falling out of the criterion, as you'll know the standards, there's about 90 of them, we fell short on 7. Fortunately for us, nothing major, in as much as whilst we were told we needed to improve, we weren't given sort of set time scales or anything like that, but we had work to do. And of course, all centred around infection, prevention and control. So we put together an action plan based on the Hygiene Code standards specific to the Care Quality Commission's visit. And we went out, we educated all our staff, we made sure that they were fully aware and updated to exactly what we were doing. And they needed to see change because we had the comment, we'll believe it when we see it. We've heard it all before, and this needed never to happen again. So that's what we did. We worked very, very hard, and then they came back. We could have viewed this as just a spanner in the works, really, because we had perceived ideas of where we wanted to go. But instead of that, we worked very hard, and they did come back. And this was the comment. It said, when we followed up, we found no evidence that the Trust had breached a regulation to protect patients, workers and others from the risks of acquiring a healthcare-associated infection. So that was very good. They said they were very, very, very happy, which made me very, very happy because I kept my job, which was quite important for me. Then they decided that they'd use us as a case study, and we were in their first magazine that was published, Regulating for Better Care. And they noted in there that considerable improvements in infection prevention and control following the Trust's investment of over 900,000, and it's exceeded that obviously to date, in cleaning and training as shown by the Care Quality Commission reports. And that's exactly what we did. We looked at training, but training in a special way. Infection control shouldn't just be a bolt-on, an add-on. We made it an integral part of our training, so that if you are told to go and perform a task, you had to include the infection control elements. And that, to us, was very important because it embedded infection control into each of our procedures. Then this came along, just when you think you're going to get there again. H1N1. Of course, looking back now, we probably think slightly different about it. But at the time, it was a big thing, wasn't it? And as we spread people about everywhere, of course, everybody points the fingers at the Ambulance Trust and says, you may be the weak link. And we have to prove very quickly that we do have robust systems in place. I was privileged and asked by the Department of Health to put together some guidance, specifically around the containment phase 5 of a pandemic. That really concentrated on hand and respiratory guidance, as well as measures in place to protect our control centres and our Gold Command. We started a vaccination programme, and the uptake within the service was excellent. And that led on to the norovirus toolkit. So norovirus now is the new H1N1, isn't it, for us? It's what we're going to be concentrating on at the moment. It shut more wards than H1N1 did.